All right, thank you so much, Dr. Hesse, for that great introduction and background on HINTS. What I will say, when I should have said this earlier, is if you could hold all questions till after Dr. Moser's talk. So I'll give you a bit of an overview on navigating the online resources, and then Dr. Rick Moser will dive in more into how to actually work with the data and do the coding within SAS Callable Sudan. So after that, then we'll open up for questions. So unless you have something really urgent and we're really confusing you, if you could do that. So as I said, my name is Alexandra Greenberg. I'm a Cancer Prevention Fellow here at NCI, and I've been working with Dr. Hesse and Dr. Moser intensively on the Health Information's National Trend Survey over the past year. And what I thought we would do is we would really take you through how do you come up with a question, how do you determine if HINTS is the right fit for your study that you want to undertake, and how do you really get started. And so we're really, and for many of you who have used HINTS before, this may seem very rudimentary, but bear with us. We'll get to the, if this is not the good stuff for you, we'll get to it shortly. So first we're going to talk briefly about, is HINTS the right data resource for your study? And then we'll talk about how do you go about finding out whether HINTS has those items that could help you answer that study of interest, your question of interest. And we'll approach that from two perspectives. The first is, if you have a general topic of interest, how do you go about coming up with a question or seeing what HINTS can do for you? And if you have a specific hypothesis, then saying, okay, well, is there a specific item, doing a question or item-based approach to interrogating the resource. Next, we'll talk about the extremely spiffy thing that HINTS has, which is you don't have to type a single line of code in order to get the summary statistics to see if this is a good fit. So you don't have to go through the whole rigmarole before and get all the data in and do all the coding and all the formatting and then realize this is not going to work. It's a great little feature. And then finally, we're going to get to the good stuff, downloading the data and understanding not only the data sets, but also the plethora of files that go with it that can make your life easier if you actually just stop and read them. So as Brad mentioned, HINTS is really aimed at looking at health behaviors, health information technology, and other related communication items over time. And it's been great because you can actually trend over time. And so if that's the general area that you're interested in, it's really an excellent resource for a secondary data analysis project. But let's say you're coming from a broader perspective. You're interested generally, say, in health communication, but you don't have a specific question. What you can do is approach this one of two ways. You can go to View Questions or Topics and click on that. And what you'll get is a series of menus, and these menus are titled with each of the broad topics or themes that HINTS covers. And you can click and expand those. And what that actually does, and even when I have a specific item in mind, I approach this way. And I will say that this is a great tool, and I'll mention why it's a great tool in a minute, but when you're writing your paper and you need to find all the literature that has been done in HINTS in your area relevant to it, it's a great little cheat trick. So you click and you expand the menu, and you see that you can click on the first link on the left is Read Related Questions. And that'll pull up every single item that's ever been asked in any administration of HINTS related to your topic, so cancer communication. Another link will have the related briefs. As Brad mentioned, this is a great way to highlight what the community has done in exceptional papers and work. So you can kind of get some ideas from that. And then finally, you can click and actually pull up every single publication using any of those items related to that area. So it's really great for getting a broad knowledge base when you're starting out and coming up with an idea. But let's say you have a specific question. You want to know, say, how many individuals have used or looked for cancer information ever. And you want to get that frequency and look at what some predictors of that might be. You can go through the questions mode rather than the topics, and that'll get you honed in much more quickly. And that'll pull up a search menu, and you can see from the search menu it's the same topics that are pulled up under the topic area, and you can search within each of those for just get right to the items. And then you can see there's also a second box that you include in the search area where you can choose specific administrations of HINTS. And so let's say, continuing to work through this lens, we are interested in cancer communication. And let's say we want to look at every single administration of HINTS. Now, one nice thing is you don't have to click 7 times for all 7 cycles. If you leave it blank, it'll pull up all 7 cycles worth of items. There is one thing that we do need to note that is important, and it's a funky little thing with the algorithm here with the search mechanism, which is, and it's a bit counterintuitive. Say you want to find items that were administered both in HINTS 1 and HINTS 2. If you click 1 and 2, the way the algorithm is, it'll pull up HINTS 1 items or HINTS 2 items that are relevant. It won't do and. You might get some that are both, but it's counterintuitive, so you'll get or. Just something to keep in mind. So you'll actually have to go and do your due diligence and make sure that it's been asked in all of those sections. So you get to this results page, and as you can see, you have 81 items found. Yay, that's a plethora of data that you can dive into. But the results page is really handy because you can see for our first question, have you ever looked for information about cancer from any source? You automatically get the related articles and briefs that use this item, not just cancer communication, but this item. So you don't duplicate any work that's been done and don't step on any toes. You can also see there's a legend on the right-hand side that tells you which cycles and which administrations this item was used in, which is really quite helpful if you want to trend on an item and see what happened from 2003 all the way through 2014 and soon to be 2015, 2016. As Brad said, we've got plenty more coming down the pipeline. Just as a contrast with the next question, you can see that there are no briefs that have been published using the next question. And you can see that it's only really utilized, it's only really been used in HINTS cycle 1 and 2, or administration 1 and 2. But what I think is really helpful, and this is kind of my approach to it, is to look at the summary statistics. As I mentioned, you don't have to type a single line of code to get to these. You can click all on any item, and that'll pull up a really nice bar graph. Now you can copy paste this, throw this in with appropriate references, of course, into any PowerPoint, any project you have. This will give you, on the y-axis, the answers to your particular item of choice. And on the x-axis, you have the the scaled percentage. In this case, the default is the United States population percentage. As Brad said, one of the strengths of HINTS is that you can use jackknife weighting, which we'll talk about. If that sounds scary, hold your horses, we'll get there. But you can use that to find population representative estimates. Now, if you wanted to play around with the data a little bit more, you can go and click all sets and years and look at the data and the summary statistics for a specific cycle. If you aren't digging the bar chart, you can change it to a line graph and do trends over time with lines. If you want to get the sample percentage rather than the population percentage, you can do that as well. As I said, the US population percentage is the default, and that is what we tend to report in manuscripts for the most part. And finally, if a PNG file isn't floating your boat, you can go for a JPEG. So that's great. You can really play around with the data. But I do want to highlight that it gets even better. You can click on a specific cycle, and you get this great table. And what you can see from the table is that you have, at the very bottom, you have survey notes, and that tells you where the question came from, what the denominator is. So it was people who looked for information about health or medical topics from any source was our denominator. And you can see it was administered through mail. But the table is really the gold mine. You can see on the left you have 1, 2, and 9. So that's the coding that you get in the variable in the data set when you download it. The next column over, you can see response. So yes, no, missing data. That's what those codes correspond to. And then jumping to the far right, you can see the survey respondents. You can see the actual number of survey respondents who responded to each question and the survey sample percentages. And then in that middle green column, you already get the weighted population percentages. Granted, they're unadjusted, but in terms of other covariates, but you get the weighted percentage and the estimated US adult population, and that's really handy. So let's say you back-clicked on your browser and you went back to that bar chart and scrolled down. This is the other thing that I find immensely helpful, is that there's this great table that tells you about what the item history was specifically. So you can see that you can look at the question text over time and see if the way the question was asked changed over time. And this is critical if you're looking at trending over time, but it's also especially important if it's a question about sensitive data like HPV or income. So you really need to make sure that it was the same over time, and if not, you need to note that in whatever write-up you do. The other thing is HINTS is a living document, so it often changes, and we often change our skip patterns. So you can see that for most of the cycles, every single person who answered this survey answered this particular item. But you can see for HINTS 4 cycle 2 and HINTS 4 cycle 4 that it was a skip pattern. So only the individuals who said that they had ever looked for any health information were then asked, do you look for information about cancer? So just something to bear in mind when you're relaying your percentages. And finally, you get all the HINTS briefs related to this item across all cycles at the bottom. So that's great. You're probably chomping at the bit. You're like, okay, I get it. Let's show me the data, right? Well, not so fast. One more thing, and again, I am a stickler about this, but it's just because it makes your life easier if you do the footwork, is to look at the actual survey instrument. So you can go to Data Instruments and click the Survey Instrument. And you'll pull up this page, and you'll be able to see the actual PDF of the document that was sent out to your participants. So you'll have an English version, full content. you'll have a methodology report. Now, if you haven't ever worked with HINTS data before, the report does get into a lot of detail, but I recommend at least looking at one so you understand the sampling frames, how the jackknife weights work. I know that Dr. Moser is going to do a fabulous job telling you about what jackknife weights are, but if you need a refresher, you want to see the actual formulas and really understand the content, it's a great resource. And then for some of the cycles, we also have the English, we have the English and the Spanish versions. So let's say you open up the questionnaire and you see that you actually get the PDF of what was administered. And it's great because, as I mentioned, this is from HINTS for cycle 2. So we had that skip pattern. So you can see that question before, if you said no, you'd go to another question. If you said yes, you'd go to, this is a different question, it's more general than the cancer question, but you can see that you get redirected. The thing that I think is very helpful about this is it gives you the context in which the participant was answering the question, which you can't get just from the data set. But you also get this annotation in red. So you can see that the name of the variable for this particular question was where seek health info. The other thing that's very helpful is you can see that it actually gives you the coding for the responses. So 1 is books, 2 is brochures, 3 is cancer organization. So this really kind of gives you a head start when you go to actually look at the data itself. Okay, I promise. Now we're getting to the data. So you'll go to Data, Instruments, and click on Download Data. And you'll get a data terms of use, and you'll scroll down and put your email in and check accept terms of use. You're not signing away your life savings, your firstborn child. It's just standard data use agreement. And that'll bring you to the public use data set. Now, the great thing about HINTS is that you can pick your weapon of choice in terms of statistical package. We have SAS for SAS callable Sudan. We have STATA and SPSS. SAS tends to be our statistical package of choice because you can use Sudan in it, as Dr. Moser will talk about later, and that really allows you to accommodate the jackknife weighting and really get the most accurate weighted U.S. population estimates possible. But when you click on this, it's great. You get the data, but you also get a whole slew of other things. And I'm just going to walk you through this because while it looks like these documents all have the same name and if you just want to get right to the data, you can really save yourself a lot of heartache if you start out with the analytic recommendations. And if you open up the analytic recommendations, you get a table of contents, and this is specific to each individual cycle. So it varies a little bit differently, and as Brad mentioned, there was a difference in administration between mail and telephone in HINTS 3, so the analytic approaches are slightly different across cycles. So you could read through the whole thing, but the thing, if you want to just, get going, what I would suggest is looking at analyzing HINTS data and important analytic variables in the data set. And that'll give you information about specific items or highlights of this particular cycle, any specific considerations for this cycle's analysis that might differ from the previous ones. And it will also give you information on the names of the weighting as well, because the weight names, as you'll see, are different. Things are, as I said, it's a living document. Things change over time, and you want to make sure that you harmonize all variables. The really great part, and this is all Dr. Moser and his foresight with this, but you really get these appendices that have, for each individual statistical package, sample code. Literally, you can copy and paste the code in, put your variables in. It includes loading the data in, formats, jackknife weightings, linear regression, and logistic regression. So you can really, and it also tells you how to interpret the output as well for the specific statistical package. So it's really very handy, and rather than coding de novo, I highly recommend you go take a look at this. The other files that I really think are key here are the formatting files. And so what that is, as I said earlier, it's coded as like 1, 2, 9, -9 for yes, no, missing. But when you're doing analysis, you don't want your tables to be labeled 1, 2, 9 and be scrambling back to the code book all the time. So using the formatting file really assigns those so that when your output comes out, it says yes, no, missing. Trust me, you don't want to be running back to the code book every 5 seconds. It makes your life a lot easier. If you're really particular like I am, you might want to create your own formatting, and we can talk about that in a moment. But it really, I would definitely advise at least starting off with this when you're doing some exploratory analyses. Then you have your SAS7BDAT file, which is just a fancy term for that's your data. That's what you really want. And finally, you have the code book. And this is the other thing that I would really emphasize taking a look at. As I've said several times, HINTS changes over time. And the variable that you're trending on might change over time in terms of its name and how it's coded. So you can see here, for this particular example, the variable is coded as seek cancer info. But in other cycles, it's cancer info, it's seek info. It varies from cycle to cycle. And if you're trending, you need to make sure that whatever you're taking and using to create a new variable, you're using the right source. Otherwise, you'll get error messages out the wazoo, and you'll just want to throw your computer out the window. Trust me, I've had that feeling this morning. So that's something to be diligent about. We all forget to do it, but I would highly recommend it. The other thing is that how it's coded changes over time. So here you see that inapplicable, question answered in error, and missing data are -1, -2, and -6. If you go back to HINTS-1, it's 97, 98, 99. So you need to make sure that you're coding your missings appropriately, so you're not getting underestimates or missing things. So I'd highly recommend that you take a look at these code books for each cycle. For the analytic recommendations, you can kind of look at one, and if there's something wonky, then you can go back to the others. But this, make sure you look at each individual code book. The other thing that I will say, and I mentioned reformatting, and we'll show you some examples of that in a little bit. But if you're doing regression, logistic regression, particularly in South Callable Sudan, it needs to be coded as 0 and 1, not 1 and 2. So that's where you need to create your own formats to make sure that you're not going to get an error message and something that says your outcome doesn't exist, even though you're looking right at it. So as I said, we'll talk about that in a moment.